Hey there. You know that feeling when you bite into something and it's like, wait, is that a popcorn kernel? Oh no, it's my tooth. Okay, maybe not quite that dramatic, but our listener today is dealing with something equally unwelcome, setting up camp in their mouth, a salivary gland stone. And trust me, you're in for some fascinating insights as we help you unpack this. We've got your stack of articles and research right here ready to extract those knowledge nuggets you're after. So you're probably wondering, what exactly are these things?
Well, think of your salivary glands like little fountains in your mouth, constantly producing saliva. Saliva, it's the unsung hero of digestion, keeping things lubricated, protecting your teeth, the whole 9 yards. But sometimes those fountains get a little gritty. We're talking mineral deposits, tiny clumps of calcium phosphate and calcium carbonate that decide to solidify and hang out where they shouldn't. That's your salivary gland stone, or silithiasis if you want to impress your dentist with fancy terminology. Now here's the kicker. These stones are surprisingly picky about their real estate.
You're telling me there's prime salivary gland real estate. Who knew?
Right, but seriously, over 80% of the time, these stones set up shop in the submandibular glands. Those are the ones tucked under your jawline.
80%. That's like rock star status in the world of salivary gland stones. What makes these glands such a hotspot?
Good question. Turns out, the submandibular duct, the little tube that carries saliva from the gland to your mouth, is a bit of an architectural marvel. It's longer and has a slight uphill curve compared to other salivary ducts, which might make it easier for those mineral deposits to get comfy and start forming a stone.
Like trying to roll that snowball uphill. It's going to gather more snow. Right. So we know what these stones are. But before we get into the nitty-gritty of why they form and how to deal with them, let's talk about how you even know you've got one. What should people be on the lookout for?
Well, imagine having a tiny pebble, like stuck under your tongue, not exactly comfortable, right? That persistent lump is often the first sign.
And let me guess, it probably becomes even more obvious when you're trying to enjoy a meal, huh?
Exactly. Eating can be a real pain. Literally. See, the stone can partially or completely block the flow of saliva.
Hold on, so it's like a traffic jam in there. No wonder things start to back up.
You got it. That blockage can cause swelling, dryness, even some pretty intense pain. You might also notice bad breath or even have trouble opening your mouth fully.
Yikes, that sounds miserable. So at what point should someone say, okay, this is not just a popcorn kernel, I need to get this checked out?
If any of those symptoms stick around for more than 2 weeks, it's time to see a doctor. And definitely don't wait if you're having trouble talking, swallowing, or breathing, or if the swelling is severe.
Always better to be safe than sorry. Now, I know we've been focusing on salivary gland stones, but are there other conditions that could be causing similar symptoms?
Absolutely. It could be a salivary gland infection, a tumor, or even an autoimmune disorder called Sjogren's syndrome. That's why getting a proper diagnosis is key.
It's like when your car makes a funny noise.
Yeah.
You don't want to just slap on a new muffler without, like, figuring out the root cause. So how do doctors differentiate between these conditions and confirm if it's actually a salivary gland stone?
It starts with a physical exam, of course, feeling for any lumps or swelling. But to get a really clear picture, imaging tests are incredibly helpful.
Imaging tests, like an X-ray vision for your mouth.
You could say that. We're talking ultrasounds, CT scans, MRIs. These can spot even tiny stones lurking in the salivary glands and rule out those other possibilities.
So once the diagnosis is in, what's the game plan for evicting these unwanted tenants?
Sometimes the simplest approach works wonders. Gentle massage, staying hydrated, even sucking on sour candies to get that saliva flowing. Those can all help encourage a small stone to pass naturally. Warm compresses can also provide soothing relief from pain and swelling.
Sour candies. That's a treatment I can get behind. But what about those more stubborn stones that refuse to budge?
That's where things get a bit more high-tech. One common procedure is called silendoscopy. Now, I know it sounds intimidating, but it's actually minimally invasive.
Minimally invasive is always music to my ears. Tell me more.
So imagine a tiny little camera, almost microscopic, that's gently inserted into the salivary gland duct. This allows the doctor to actually see the stone and remove it, sometimes using even tinier tools like baskets or balloons to help extract it.
Balloons. Now that's just showing off. It's amazing what they can do these days. But are there cases where even this high-tech approach isn't enough?
You're right, silendoscopy is often very successful, but in some cases, especially with recurring stones in the same gland, surgery to remove the gland entirely might be recommended. It's not the first choice. but it can be necessary to prevent those constant battles with salivary gland stones.
Wow. So it's like saying, all right, team, we've tried everything. Time to renovate. But on a serious note, it's reassuring to know there are options even for those tougher cases. We've talked a lot about dealing with these stones, but what about prevention? Can we make our mouths less inviting to these mineral squatters in the first place?
Absolutely. Hydration is key. Think of it like flushing out those salivary glands regularly. And as much as it pains me to say it, quitting smoking is another big one.
Okay, so water good, cigarettes bad. Got it. What else can we do to keep those salivary glands happy and stone-free?
Good oral hygiene is crucial. Brushing, flossing, regular dental checkups, it all contributes to a healthier mouth and reduces the risk of those pesky stones forming.
So in a nutshell, for our listener and anyone else dealing with salivary gland stones, remember knowledge is power. Understanding the causes, recognizing the symptoms, and knowing your treatment options can make all the difference.
Absolutely. It's all about taking charge of your oral health and being proactive.
This deep dive has been fascinating, and it's got me thinking. We've covered how smoking and hydration can impact these stones. But could there be a link between our diets and these mineral buildups? Could certain foods make us more prone to salivary gland stones? That's something to think about.
That's a great question. While research is still ongoing, it's certainly a possibility. The composition of saliva and the likelihood of those minerals crystallizing can be influenced by various factors, including what we eat. Definitely an area worth exploring further.
There you have it. Maybe the next big breakthrough in salivary gland stone research involves analyzing people's love for salty snacks or their weakness for sugary drinks. But until then, stay hydrated, keep those pearly whites sparkling, and if those unwelcome mineral guests decide to move in, you'll know exactly what to do.